What I'm wondering is, well, I mean, maybe address that as well. But if you were to look forward and think about, a few years down the road, where you see this power dynamic landing, is it with the payer? Is it with the health system? In some ways, is it with the manufacturer? Probably less so there. But how do you see all of this playing out?
We're all trying to do the right thing, right? We're
Sure.
trying to make sure the patient really gets what they need and really has that positive clinical outcome. But what I think is really missing is the incentives are misaligned, as we're trying to care for this patient, right? The incentives on the payer side, the PBM side, the provider side really are not aligned, right? And so where Longitude RX really thinks the future is really an integration and transparency. And that's why, would love to touch on the technology side later in our discussion, but it really is about integrating the different data sets, really having transparency across the continuum of care that's needed to really solve for this issue. And I think if we do that, we can actually get a win-win-win across the board for all the players that are trying to collaborate, really, to make sure the patient is getting what they need, right? And the support that the patient needs.